Good morning. My name is AmandaJean Beaulieu, and I'm a stroke survivor and American Heart Association volunteer advocate from Minneapolis, Minnesota. This is warm to me. I'm honored to be invited to share my story. Thank you, Leader Pelosi and other members of Congress, for your leadership in passing the Affordable Care Act so that people like me, who used to be called uninsurable, can have the peace of mind and security of never having to go without health insurance again. In October of 2009, just 5 days shy of my 27th birthday, I had a massive pulmonary embolism in my left lung. Part of the clot broke off and traveled to my brain, causing a stroke. Fortunately, at the time, I was covered by my employer insurance, but that changed a year later. In 2010, I left my job and found myself trying to get insurance in a world that didn't want to cover a risk. I was no longer seen as AmandaJean. Instead, I was seen as a pre-existing condition, a drain on an insurance plan. Even though I had fully recovered from my stroke and was young and vibrant, my medical history plagued me. I searched for affordable insurance coverage, but the cheapest plan I found was $700 a month for subpar coverage. During this time, I worked as a contractor with no health benefits whatsoever. For more than 18 months, I went without health insurance, an experience that was like jumping into shark-infested waters without a cage. I quickly learned how much medications really cost and had to decide between picking up my prescriptions or paying my monthly bills. Even so, as a pulmonary embolism and stroke survivor, there were medicines and tests that I couldn't go without in order to prevent another hospitalization. Medical bills started piling up, and before I knew it, I was $10,000 in debt. In the fall of 2011, I managed to get a staph infection in my knee. I begged and pleaded with the emergency room doctor to let me go home. I told him, I can't afford this, just let me go. He let me go home 4 days later. I went home and waited for the bills to come. I cried when I saw the total and cashed in my 401k to pay most of it off. At this point, I decided I had no choice, so I sought employment with a collections law firm, even knowing that that wasn't my cup of tea. Their insurance, it sure was. Unfortunately, however, in 2013, that company downsized and I lost my job and the health insurance that went with it. Fortunately, this time around, my search for individual coverage was very different. Thanks to the Affordable Care Act, I filled out the online application and chose a plan. When I saw the premium amount, I thought the insurance company was playing a joke on me and had made a mistake. I called and spoke to a representative. She double-checked and said the premium was correct. After a long pause, she realized I was crying. I explained to her that having affordable insurance meant I could hold out for the job I wanted and not the one I had to take. But by the end of our conversation, she was crying too. I no longer have to worry about whether I can go get or pay for health insurance or how I'm going to pay for my medications. I no longer have to delay or skip going to the doctor. I am finally, truly putting my health first. Thank you so much for passing the healthcare law and giving me peace of mind and for letting me share my story. And now I'll turn things back over to Leader Pelosi.